Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in two cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Welcome back. So that is the patient. And that is what we have gone through with this patient. First, we stabilized the heart. It's very important. The breathing was okay. And we have to take care of him according to the complication he's shown, but we have to be very fast, because when we took the sodium level in this patient, the sodium level was about 200 something. You know, one thing about, if you want to understand how can cocaine does all that, only if you understood one thing cocaine does, you will understand how can cocaine do all this damage. Cocaine blocks the sodium channels. The sodium channels in your body. That's all over your body. You know, I don't want to get too medical and too technical, and for the audience out there not to be difficult to understand. But we have, we don't have wires go from the brain to the rest of the organs. We have, chemicals like sodium. That this is the most common intracellular ion that goes inside the cells based on concentration gradient. And then we have the potassium, that is the most abundant extracellular outside the cells. Is the exchange of those sodium and potassium, one goes in, one goes out, that what we create something called action potential with the help of something called ATPase enzyme. This is all technical, forget about it. But what I'm trying to tell you is this: the propagation of the signals coming from the brain to all different organs is controlled by that sodium channel, let's say. So if I have this cocaine manipulating these sodium channels and blocking it, we have really interfered with all the signals going from the brain to the rest of the organs. So this cocaine that you're smoking out there can cause multi-system malfunction, because the signal that is relying on the influx of sodium through its channel has been blocked by this cocaine. So when we took the guy's sodium, it was very high, because it's not going inside the cells anymore, it's remaining outside in the blood. So you can measure now, can we get pulmonary damage from this guy that is using cocaine? Yes. First of all, simply because he's smoking, and that thing is not really good, so it causes ulceration in the airway, but nevertheless, this is not a problem. We can deal with that. It's not going to kill you. But what's going to kill you is a thrombus, is a clot in the lungs. And we said, cocaine causes vasoconstriction for the same reason about the sodium channels. So if we have vasoconstriction in the lungs, in the vessels of the lungs, and we know cocaine can cause thrombosis, which is small clots that can launch in the lungs, we have pulmonary embolism that can definitely kill you. So those are things that has to be taken in consideration when you're dealing with somebody with acute intoxication or possibly overdose, that when it comes to the hospital. We have to keep in mind that we cannot have this guy forming clots, number one. We cannot have this guy go into a heart attack, that's number two. We cannot have this guy going very high blood pressure to blow a capillary in the brain, that's number three. Yeah, talking about capillary in the brain, those guys can get also intracranial hemorrhage, bleeding inside the brain. All this can happen because of cocaine. All this can happen because of cocaine. You can die in an overdose or acute intoxication of cocaine. Can amphetamine do the same thing? Yes. Any CNS stimulant, there are degrees. What kills you the most is cocaine. You cannot calculate the dose, and those people who give you those drugs, they don't know how much they put in there. One batch could have a high dose, one batch could have a lower dose. They're not pharmaceutical companies to calculate, okay, this smoke has such and such milligram, and this package here has such and such milligram. They back it anyway. And we don't even know what's inside there. We know it stimulates the CNS, and they claim it to be cocaine crack, but who knows? Who knows? Is it natural? Anyway, the best way is to stay out of it. Stay away from it. It causes you hazard to your health. It will kill you. How many people have you heard of died of overdose? How many? A lot. A lot. So overdose can kill you definitely. Especially if you don't have the right medical facility around. And especially if, they die. Believe me, they die. If you don't have the appropriate immediate care, you die. So the best thing is, when you know you have a problem with addiction, the craving, meaning I want the dose, is so strong that overcome everything. Like I said earlier, those patients live for the drugs. All their life is centered about the drugs. They breathe the drug. They woke up in the morning talking about the drugs. They go to their friends, they only talk about drugs. He only hang out with those who take the drugs. Everything to them is about the drugs. Everything in their life is centered about the drug. I'm going to go this place because I'm going to find the drug. I cannot go to that place because there is no drugs there. So all their life now is controlled by the availability of the drugs. All their future is centered about the drugs and how much they're going to use the drugs. So who controlled their life? The drugs. And so now they are like a remote control. The drugs is everything in their life. Meanwhile, the family is suffering. Financially, emotionally, everything. So when you have a drug addict in the house, I feel for you, because that's a total destruction, not only to the person himself, but to the family also. And the community. And the whole society after that. So we cannot have this kind of patients, and all of them are young people, very young. This guy was 20 something. He is not the only case that I have seen. I see many, but I just would like to I share this with you so you can see. We stabilize the patient. We give the patient the appropriate medication. 4 or 5 days later, the patient was fine. And here is the video after 5 days of admission. I let him go after a week or so on follow-up, to come and follow up every 1 week. The detox process took us about 5 days. And let's look at the patient after recovery. Now, he's talking. Everything is okay. Do you remember anything of what happened to you? Do you remember the attacks you went through? Do you remember the compulsions that you had, and the aggression and the fighting and want to kill everybody? Do you remember? No, you don't remember. No. He's a nice boy now. A very nice gentleman. Okay, boss, you understood the situation. Mommy, you understood. So you're smiling now. She was crying for you, huh?
Yeah, mommy was crying.
Hey, she was crying.
Every day, Asha mommy.
Well, thank God. Alhamdulillah. So he's a different person. Remember, he was not talking. He was just fighting. Okay, he was not talking. Now he talks. Now he's a different person. Totally different person. And when he came in, he refused to take medication. 10 people have to hold him down to give him an injection. And he refused to open his mouth. So how are you going to lower somebody's like this pressure? We have to revert to IV under force. We have to give him the IV to lower the pressure. We have to give him. So it was a difficult case at the beginning, but things has to be done to secure the patient and save the patient. And we thank God, above all, that the patient was saved. And a few days later, he's back home. And I hope I don't see him again in this scenario. He learned a lesson, he was not in his conscious when he did what he did. And when I ask him, do you remember any of this? He doesn't. He doesn't remember any of it. All right, so this was a nice ending for somebody who got immediate treatment, and he recovered, and he went home. So that's a nice thing. Now, not only guys go on medication, also ladies. And like I said, everything in their life is about the drug.